and he couldn't stop, and ultimately he died from this. When I did outreach to the local hospice nurses in Pueblo itself, they had a man in hospice because he had a hyperemesis but couldn't stop smoking. The mother said on this kid, he loved weed, the vomiting began, and months later he died. We see this every single day in our ER. We see someone with this every single day. The only real treatment is stopping. It takes several weeks, even months, for the symptoms to go away. It's like a washout period. You can't just stop for a couple of days and be better. If we look at just the expense of seeing these people in the emergency department, say we see 1 to 2 cases a day, but for math, we're going to do 1 case a day in 1 ER in Colorado. We have 25 ERs in Colorado, so 1 case a day, 1 patient in 1 ER. The billing is about $6,500 because they frequently get CAT scans, they get IVs, they get medications, they get ER visits, they're seen by the doctor, etc. This doesn't count admissions, it doesn't count scoping, it doesn't count ICU care. But just the 1 ER visit a day, it's over $2.3 million in billings in a year. That's just for 1 patient in 1 ER once a day. And we're seeing at least 1 to 2, and now we have 25 ERs in the state. So you can see how rapidly we're not making money, we're just shifting the cost center, right? Because we're all paying for the 69,000 people who are Medicaid, who are coming to our ER, who are vaping or using cannabis and having problems like hyperemesis. So we're just cost shifting. So that can tell you that your community is going to make bank, but we're going to be all paying for this because our costs of healthcare are going to dramatically go up. So they did a recent study in radiology, and to diagnose, because it is a diagnosis of exclusion, which means that I have to make sure you don't have ulcers, or maybe it's not your gallbladder, or maybe there's something else weird. So it's a diagnosis of exclusion. Many of these people get repeated CTs, they get repeated evaluations, they get repeated ER visits. And we're talking, like, I saw a guy who came in every day for 7 days in a row. And then when I said, I think it's the weed, his dad actually took a swing at me and said it's not in the pot. So, and you think about like the cost. So the average cost to come to diagnosis of hyperemesis is about $76,000, and this is a study from California. That study's up here on the slides. If you want to take that down, you can reference it yourself.